I'm Dr. Roland. I'm a pediatric neurosurgeon at Washington University in St. Louis and St. Louis Children's Hospital. I decided to practice here at St. Louis Children's Hospital because we have a phenomenal group of partners that I work with, from our neurologists, our epileptologists who are treating epilepsy medically, to my partners in neurosurgery who are focusing on other specific challenges. We have a fantastic group of individuals and a terrific amount of resources to help me in those day-to-day routines. So what I hope to provide to patients here at St. Louis Children's Hospital is an opportunity for treating conditions that otherwise they might not realize they have an opportunity to treat. So for instance, for me as a neurosurgeon focusing on epilepsy treatments, there's oftentimes a lot of patients who don't realize that neurosurgical treatments are even an option for them. And that turns out to be a really big deal because there's a lot of patients out there who could potentially benefit, maybe even cure their epilepsy, but haven't sought that next level of evaluations. Oftentimes it's because of the fear of what a surgical intervention might mean. And one of the things that we work really hard to try to spread the message to those patients and their parents and their referring providers is that there's a wide range of what that means. Some patients, that is a large surgery. Some of those surgeries do have risks, but part of my job is always to help understand those risks and help balance those risks. I also want patients to know that I have a lot of tools in my toolbox to help me with those treatments that are much lower risk and sometimes have just as good, if not better, outcomes. And so what I like to tell people is that not every intervention that I have as a surgeon means a very big surgery. Sometimes it's really minimally invasive surgeries. Sometimes it's procedures that you go home the next day from, and finding which of those interventions, if any of those interventions are the ones that are right for you, is the goal. So I think what I would want parents and patients who are considering coming to St. Louis Children's Hospital to know is that we have such a wide range of breadth. We have pretty much every subspecialty covered. And we also have experts who not only cover the full breadth, but also in the great depth of each specialty. So for instance, myself, I focus a lot on epilepsy. I also treat cerebrovascular disease. I treat a lot of tumors, and I treat a whole lot of other things at great depth. And my partners have a lot of expertise in things like Chiari malformation and syringomyelia and movement disorders. Each part of that full gamut we treat in great breadth and depth. And I think that makes us very special and very unique that not a whole lot of other institutions have.